Hi everyone, Chuck Gaidica here for a Healthier Michigan podcast. For the next few episodes, we're doing something a little different. We were recently invited up to the Mackinac Policy Conference held each year on Mackinac Island and thought it would be a great opportunity to talk to attendees about their health journeys, as well as how some guests are serving health initiatives that impact the community around them. We hope you enjoy these bonus episodes, and we'll also look forward to bringing you our next new episode on June 13th. On today's bonus episode, we'll be talking with Blue Cross Blue Shield of Michigan CEO Dan Lepp and his wife Amy Lepp, co-founder of Impact 100 Oakland County, Paul Hilligans, CEO of the Michigan Health Endowment Fund, and Tony Michaels, President and CEO of the Parade Company. First up are Dan and Amy Lepp. Dan Lepp has been the president and CEO of Blue Cross Blue Shield of Michigan since 2006. He is also involved in many organizations, including the Parade Company Foundation, where he has been chair for several years, and also the Mackinac Island State Park Commission, which Governor Snyder appointed him to in 2015. Amy Lepp is the co-founder of Impact 100 Oakland County, and she also serves on the board of directors for Eaton Academy and the Belle Isle Conservancy. Amy has her own consulting company, Tatry Strategies. So I'm joined now by Dan and Amy Lepp. Dan is the president and CEO of Blue Cross Blue Shield of Michigan, and we are happy that his wife Amy is here with him. It's good to see you sharing a microphone so close.
Absolutely.
It's like you know each other.
Right. Each other a time or two.
We don't share those Fitbits, though.
Well, are you using any device? I saw Amy has a Fitbit. Are you tracking?
Absolutely. We have been competitive for a long time. I mean, how many steps do you have? How many steps do you have?
And then if you have lesser steps, then you go to how many active minutes do you have? How many stairs have you had? So some way you hope to get at least one of them.
So we don't know today's total yet, but how did you do yesterday? Do you know? Did you check?
Awesome. Past 10,000.
Yeah.
That's great.
Which is the goal. If we can get every day, if I get past 10,000, it's a success day. And generally, you got to work out, though, to be you're either on the treadmill or the elliptical to do that.
Yeah.
What's our high? What was our high that one year in D.C.?
In D.C., we walked D.C. It was 37,000 in one day, which was like wild.
But isn't that a great place to do that? Our daughter lives right in the city.
Absolutely.
And when you're going to the mall, or you kind of lose track of what you're doing anyway. So it's beautiful.
Yeah, it's easy to get steps there, that's for sure.
So outside of the idea that you're tracking, and I'll just say, just for street credibility, I did 12,000 plus steps yesterday.
Very
so
nice.
That's awesome, right? I passed my Blue Cross Blue Shield of Michigan goal of 10,000.
That's right.
Any other traits about healthy living that you talked about an elliptical and a treadmill? Is that something you try to do when you can't get in your steps?
We try to do it almost every day.
Yeah.
And because I think aerobic exercise, especially as you're aging, Chuck.
Wait a minute.
It's an important part of a whole lifestyle. And do we do it as well as we should? I can only speak for myself, not as well as I should, but I pay attention to it every day, and that's and I think important for people to do.
Then we do some organized activity too with different exercise.
What does that mean? Because my wife just made me take dance classes and said it was good for exercise. That was her line anyway.
We go to, and I'm not doing an advertisement, we go to Exercise Coach. It's a franchise in Royal Oak we live in Birmingham, and it's a 20-minute workout 2 or 3 times a week where it's been phenomenal. And
it
really
sounds
does.
crazy that it's only 20 minutes, but you're out of there, shaking and sweating.
Right.
Do you know what I just started? So the dance lessons things kind of came and left because we have a wedding coming up in June. I started boxing classes.
Okay.
Title boxing. I'm having so much fun. You should see that 100-pound bag. Oh my gosh. It's a stress reliever. You're burning off calories. You're really pouring sweat, so it's good. What about eating habits? In a place like this where everywhere I'm looking, there's like somebody's got a muffin or a donut or something.
Or some bacon. We've gotten much more into plant-based food. I mean, we're not, I don't know, I wouldn't say we're religious about it, but really thinking about every day how much less red meat, even chicken. I'm not good at fish, Chuck. It just but really paying attention to using plant-based foods, because it really, when you look at every statistic, if you can do that and make that a significant part of your diet, it's a health option that works.
So I've heard the phrase used, I lean vegetarian, right? I'm not lean meat, but I mean, I lean toward it. And I've done the same thing. So I'm adding stuff that I never had in my diet. Black beans.
Right.
For protein, I'm adding soy milk in my coffee. And after about a month, anything can taste good. You know, it doesn't have that cardboard flavor anymore.
We drink oatmeal milk, and
I didn't even know there was such a thing.
It's
And
good.
you couldn't find it, and now everybody's got it. Even Quaker's making it.
We used to have to get it online, and then you couldn't get it online, and then you started
Wow.
seeing it in stores. So
Does this friendly competition with your Fitbits and beyond and reaching for the microphone, and you're both being very polite with each other, but do you find friendly competition? Doesn't that help encourage you? I have found with my wife when she says, honey, I lost 3 pounds, I've got to lose 3 more.
We will ask each other, because you can hear the beep on the scale. So if you're in the shower and then you get out, you can hear that beep, so you know we're both checking it out.
yeah, you know somebody weighed themselves.
That's great. Is there anything about the island that you partake in? Have you ever done the loop? It's 8.2 miles, I know.
Yeah,
but-
we have, and of course we've got a long-term relationship with the Grand Hotel in the Healthy Living Grand, where everybody that comes in here gets that booklet from Blue Cross and the Grand Hotel about healthy recipes and really changing, even if you're up here for 4 or 5 days, what you can do.
Yeah.
And there's plenty of places to walk. You walk this whole island. You go to Arch Rock, actually the back end of the island. And I'm a little prejudiced, Chuck, because I am now the chairman of the Mackinac Island Park Commission. And so our job is to promote and sort of secure the island for the greatness that it is. But one of the great parts of this island is the back end of the island. And if people have never walked on the back end of the island,
Yeah.
which is 2/3 or 3/4 of the island, it's beautiful.
Oh, and that's where the airport is. It's kind of
Right.
off the
Right.
beaten path. And you know, the idea of our parks in Michigan, you're talking about, well, first of all, it's the centennial, so happy birthday,
Right.
Michigan Parks. But when I see the DNR signs and the park systems everywhere I go, all the trail systems, how much do we have to be proud of?
There's no doubt. And actually, the Mackinac Island Park was the second, after Yellowstone, the second national park in America, and then got flipped to the state of Michigan 100 years ago.
Yeah.
You know, as a state park here, and it's a gem for those that haven't been here. Beyond getting fudge on Main Street in the summer, it's a beautiful place to be.
When you're here, do you do the bike thing? Do you like the horse-drawn carriages?
We like the bike thing. Generally at this conference, not so much that
Yeah,
we
yeah.
have the
Right.
time to do it. But yeah, so we're able to come up several times a year now, especially with the Park Commission work.
Yeah, and it's fun that you can grab a lunch and drive the other side of the island. There's plenty of parks to do that. It's awesome. It is a gem of America.
Yeah.
And what I'm finding is that we spend more time up here is people from all across the country come here, folks from Texas, from California, that it's so unique as a destination. It's awesome. And for all of us that are in Michigan, if you haven't taken advantage of it, you should.
Well, and you know, you're beaming like proud parents of this island. I mean, it really is it's a gem. And here we are in the state from the one end that I drove and you drove to get up here. I think I just saw that Belle Isle is now the #2 visited park in the country. So we've got these resources in between, tens of thousands of miles of trails. It's really unbelievable of how much of that is in our backyard.
Yeah, there's no doubt. And Amy's on the board of the Belle Isle Conservancy. And what's been done down there with the DNR running the state park there, and what the Grand Prix has done to help it. It's a family destination. And, you know, I also, in my other day job as chair of the Parade Company Foundation, for the fireworks that are coming up in a couple of weeks, by 5:30 they'll cut off the island because there's so many people that want to be there and watch the fireworks. So it's cool.
And we've taught, I mean, the fact that we have these 2 islands in the state is pretty amazing. And we like when we're traveling and we talk about both of those islands and how special they are. And people, you know, sometimes haven't heard of it and they're really intrigued by the concepts of both.
And talk about, I know a lot of what you just said is wrapped up in giving back, but talk, Amy, a minute about Impact 100, because I know you were a co-founder of that in Oakland County.
Yeah, thank you. Yeah, that's been a really great organization. We just closed our membership and announced that we have 3 $102,000 grants to give away this year. So we've
That's great.
continued to grow.
Congratulations.
Thank you. Yeah, it's been, so we just are closing out our letter of intent process, going into the application process. So we'll be doing those evaluations and anxious to give away back to the community.
And being on the sidelines watching that whole operation, the first gift was through the Variety Children's Charity, where was a $100,000 grant where in Pontiac, because oftentimes on the weekends in the less fortunate communities, kids don't have food. And so the Oakland County Sheriffs would come in with food for the weekend for kids in Pontiac, where it gave not only obviously the food for the children, but a good connection between law enforcement and the community.
Yeah.
It really was awesome. And to see the women of Impact 100 Oakland County are super passionate about what they do, and it's very, very cool.
Well, for the regular listeners of a Healthier Michigan podcast, tell us one more time about the booklet we should all be looking for when we check in. That's an automatic that they give that out.
Yes,
right?
It's sitting on your nightstand here at the Grand Hotel, and it really goes through healthy recipes, exercises you can do in and around Grand Hotel, but really in and around the island. And it's been a great partnership with Grand Hotel.
Yeah. Well, Amy and Dan Lepp, it's good to see you.
Thank you. Great
Thanks,
to see you
Chuck.
too.
We'll watch you turning your wrist to compare Fitbits as the days go by here on the island.
Absolutely.
Yeah. Oh, look at they're
How we
doing it
doing?
now. What is it?
I'm winning.
Good to see you both. Thanks.
You too. Thank you.
Up next is Paul Hilligans. Paul is well known for serving as the Republican co-speaker of the Michigan House of Representatives with Curtis Hertel from 1993 until 1994. He has done many important things since, but most recently, he is serving as CEO of the Michigan Health Endowment Fund, which is a philanthropic foundation that works to improve the health and wellness of Michigan residents while reducing healthcare costs. With Paul Hilligans, the CEO for the Michigan Endowment Fund. It's good to see you.
Thank you, Chuck. Good to be with you.
This is such a great event. I mean, it is a giant hoo-ha. Everybody is walking around and you see old friends, new friends. It's wonderful.
And it's nonstop. Lots of exercise.
Yeah. And is that something you're into? Do you purposefully do that, or are you just trying to track steps because?
I do exercise regularly. That's my contribution to personal wellness.
Yeah. Well, let's go back in the day. We'll set the table here. You served as the Republican co-speaker of the Michigan House of Representatives with Curtis Hertel back in the early to mid-'90s, now CEO of the Michigan Health Endowment Fund. What types of programs are you working with that people who would be listening to a Healthier Michigan podcast be interested in knowing about?
Well, our mission is to improve the health and wellness of Michigan citizens. We focus on children and older adults, and we also seek to reduce healthcare costs. And we do that by working on intervention and prevention, integrating healthcare at an early stage between mental health and physical health. Our goal is to keep people out of emergency rooms and out of hospital beds by healthy behaviors and early intervention of clinical care.
So while that's a pretty broad net, you've got two groups you just stated. I mean, in some ways, as people age, it's interesting to me that, I just have gone through some health challenges with mom and dad, but as you see them aging, there is a connectivity for how we raise our young children and how things start to change at the end of life. But how do you differentiate that? Because we've got listeners, I'm not sure we have 4-year-old listeners, but I bet you we have some that are seniors.
Well, first of all, we do focus in the children's area on access to healthy food, good nutrition, and also early screening of social determinants of health like stress, toxic stress. Adverse childhood experiences can affect a lifetime of health, be it mental health or physical health. And so the early intervention at that stage through healthy behaviors and early detection of problems does lead to healthier older lives. But at the end of life, caregiving is important, and we're working on training, formal caregiving, but working with family caregivers. Over 1 million Michigan citizens now care for loved ones over the age of 65, and so that's an important area for us.
And I relate to it directly, and if as caretakers you are not sometimes thinking about the idea that when the oxygen masks come down in the airplane, and we hear this from the flight attendants, put yours on first so you can take care of others. I think caretakers ignore that good advice at times. I've been
Yes,
there.
indeed. Respite care for caregivers is important, but Also a network of support, just helping caregivers through friendships, through business intervention, nonprofit intervention in their lives can help them be better caregivers.
You know, back to kids, when you talk about this holistic idea of health, it blew my mind, and I can't recall, maybe you know the statistic, how many kids are going to sleep, not just in the urban centers where everybody would think, they don't have a mattress. How can you have good health? We think of food right away, right? Maybe they're going to get a school lunch program or something from a church or otherwise. But what do you mean you're never sleeping on a mattress? You've never had a bed, which means you probably have never had a good night's sleep.
Well, it's really interesting. A lot of work's been done on what determines health outcomes. Really only about 20% of health outcomes are due to clinical care. 80% is due to social and economic factors, to healthy behaviors, to the environment. And poverty, homelessness certainly is a connector to our health, mental and physical.
So of all the grants that you're working on or have worked on, is there anything specifically you're targeting right now for any end of that spectrum in age?
Well, in the older adult area, we are working on caregiving, early detection of chronic disease, and wellness, exercise, working with older adults on the hazards of falls, accidental falls, and how you can prevent that. With children, as I said, we're working on access to healthy food and wellness programs. We're also working with the medical community. Medical residence training is so important. And one of my favorite projects is working with a program to train medical residents on prescribing healthy foods, providing coupons or supports where you can get healthy produce at a grocery store or at a shop in a hospital.
But isn't that interesting if someone were to write a prescription per se for broccoli?
Yeah.
But if it comes from a professional, you may be more apt to take that advice, right?
That is exactly the case.
Wow.
Yeah.
Wow.
In the healthy behavior area, both for older adults but children, and focusing on children, 1 of every 5 children in Michigan experience a mental health or behavioral health challenge. Only 1/5 of those get the treatment they need. And so one of the important places where we can have impact is in schools. And we're doing grants. For example, there's a Trails program at the University of Michigan that is working with school districts on training educational professionals on screening toxic stress, but connecting children to the treatment they need, and helping them to cope in the classroom. If we can make that early investment in behavioral health issues, we will save so much money and create better quality of lives for people for years to come.
So let's get back to the personal stuff. I can hear all the chatter in the background. What are you doing during this conference yourself for good health and even de-stressing? What are you doing personally?
I'm trying to get more sleep than I normally have at these conferences. I am trying to eat healthy. I do get away from all of the chatter and the crowds, taking a walk, which is necessary for all of us just to get away. But just networking with people, seeing old friends is healthy too. And so I've learned to relax at these conferences. I think I've done about 30 plus of them. And it used to be a very stressful experience. It's getting easier just by going with the flow, but also taking some personal time.
Well, having friendships is good because, whether it's kids, I've seen the research, young people and older folks alike, we think we're in a world with more friends. We think they're all here.
Yeah.
They're not real friends, and loneliness is increasing as a big health risk in America, right?
It is.
Yeah. Well, it's good to see I'm not lonely anymore.
Before we break up, I should say we are a Michigan Health Fund because of Blue Cross Blue Shield of Michigan. The Blues have committed $1.6 billion over an 18-year period to this fund, and it allows us to do $30 million of grant making to nonprofit organizations all over the state, and we're very grateful to the Blues for giving us this opportunity.
Well, as a baby boomer, one of 74 million that are aging into the demographic that you're trying to help serve, I want to thank you, because sooner or later I'm going to get there. So
I'm there. Thank you.
Good to see you, Paul.
Thank you, Chuck.
And finally, an old friend, Tony Michaels. Tony joined the parade company in 2009 as the president and CEO and was on the board for over a decade. The parade company creates and produces America's Thanksgiving Parade, presented by Art Van, and the Ford Fireworks. So we're joined by Tony Michaels, president and CEO of the parade company, an old friend. It is so good to see you.
It is so good to see you, and thank you, Becky. And this is great. I love being here.
Are you enjoying the conference? Are you having fun?
Absolutely. This is a great time, and everyone's together, and you're able to have conversation, and that's as good as it gets.
So you became president and CEO of the parade company, 2009? Before that, on the board for about a decade.
You're right
on,
on, Chuck.
We've got people who know things. We have staff that have staff. I know all about you. No, but really, I mean, you and I for decades have been able to say that we hung out as buddies on Thanksgiving morning. There aren't many people in my entire life that I can say I've done that with.
No, it's really true, and it was so much fun. And I can't believe it's been 10 years, to be honest with you.
Yeah.
You know, being on the board and then how this all came to be, it's exciting. We've been able to make some great changes and make it good with great partners. And I mean that, like Blue Cross Blue Shield of Michigan and so on. It's great.
And so then you've got fireworks, which are coming up. Yeah.
Ford Fireworks, June 24th. Look, I say this every year, but this will be the biggest and best show Detroit has ever seen. And I do believe it's the best in the nation right now. I really do, because I flip on the New York fireworks and the others, and they're not the same. This is a blended, lively, crazy show.
Right.
Yeah.
And the music, just you're standing there. What are you pointing at? What?
I get to pick the music. I go through I do the music. I love doing it. Okay.
So that's great.
And then I get with Zambelli and Patrick Barreau, the choreographer, and we walk through the music and the thought behind the music. And we literally create this show. And he is a master at reading minds. And I think Detroit is in for something really special with the Ford
And the Zambelli family, that's been decades as well, right?
Decades, yeah. They are the producers of the fireworks themselves.
Amazing family.
Amazing. And Patrick, as I said, is the choreographer.
Yeah.
Patrick reads minds. They all read minds. And we put this on and, enjoy it. It's really funny because I talk to people who are lined up down Michigan Avenue watching it. I talk to people in Pontiac who sit on a hill on a clear night, and they watch the fireworks from a hill in Pontiac.
Just great.
It's everywhere.
I have to tell you, what the downside was for me for all those years? You get an invitation, and I'm sure you've gone through this, a personal invite. Hey, come to my park fireworks. There is nothing, I'm sorry. I mean, I've been for years, my neck is in a permanent position looking at fireworks on the riverfront. I'm sorry, there's nothing to ever compare.
No, there isn't. But, a lot of the local fireworks are great, and they're great for the communities. And
I know.
But that is why, too, because I'm always asked, why so early? It's very simple. In Michigan, we have a thing called Up North, which a lot of states don't have. And a lot of the people do leave the area that week of the 4th of July, so we plan it the week before the 4th of July, and it's a summer kickoff, and it fits for everybody.
Sure.
It works we have to make it for everybody. That's the plan. And so that's why it's early.
So I'm looking at you, my friend, and I know you've been for a couple of years, a health charge of your own. You're looking great. You're taller now from the last time I saw you.
Am I taller or shorter?
No, you're taller.
I'll tell you, the health thing is so important, and I was not I didn't pay attention. I was a sugarholic, a total lunatic, beyond belief.
Really?
Oh, yeah. 3 Cokes a day, Mountain Dew Slurpees, Oreos. They're all great products, nothing against those companies. But I was overdoing it.
Yeah.
And lost 45 pounds
Good
3
for
years
you.
ago. And it's amazing because I wake up every morning and weigh myself, which you're not supposed to do. But I'm 169 to 171 every morning for 3 years.
That's great.
You just learn how to eat, that's all.
Well, and this podcast is a Healthier Michigan podcast, but let's talk about the thread that even wanders through Thanksgiving morning.
Yeah.
How has the turkey trot grown over the years? There is so much fun in that morning.
Yeah, it's so great. When I decided to accept this, 10 years ago, there were probably 3,000 runners in the turkey trot, and I said, whoa, let's go here. But we did that with everything. Everything needed to get better quality, and then they became bigger, and now the company's doing much better. But the turkey trot, as the S3 turkey trot, as an example, is now gone from 19,000 runners, and now it varies from 17 to 19, depending on the weather, the forecast. And there's a lot more races now, but we've held, which is phenomenal. It really is. And S3 is a great partner, as you know, and Blue Cross is involved in that too. So we're just kind of feeling good about being involved with things that are healthy and good and good for people.
And fun. I mean, where else can you see a guy in a tutu and a turkey hat go running by you on Thanksgiving morning?
We saw that a few times when we did those interviews with Art, and we'd kick off the fireworks with the big bell, and we'd turn around and go, whoa, look at these outfits. They're great.
He's back again. So I know that you did an interview with Miss Purton, with Joanne Purton, I should say. There's so many Purton girls, I mixed them up. And with Stephen Clark, and you talked about golf. You talked about if you could do something else in your life. Would you like to be a professional golfer?
Oh, my.
If we could wave a magic wand now.
Yeah. I love golf more than anything, except my family, okay? But the professional golfers follow the sun. That's what they do all year long.
Yeah.
How great would they be? But I love to play. I'm decent, but not great.
Have you played while you've been here?
No, not up here, no.
Okay.
I'll be playing this weekend. I'm a Saturday, Sunday, 7:30 a.m., walk all the rounds with the caddy. I just have to walk.
So you walk it?
Oh, yeah. Last weekend I played 3 times, walked with the caddy each time, and that's 21 miles. Yeah, it was pretty good.
That is great.
Yeah, you're a little worn out after the third day.
Now, how long does that take you? How much of your
4
day?
4 hours.
4 hours.
And I'm done. Yeah, so that's why we like to tee off at 7:30.
Sure.
By noon, 12:30, boom, home, done. It's great.
Yeah. And so are you tempted to play everywhere you go, where you travel? Do you try to find the local course that everybody would say, this is the one?
Not always.
No.
But I do have a wonderful invite. And Dan and my friend Jim Nance, who we had as the Grand Marshal last year, he invited me to play Cypress Point this September, which is a dream come true.
And you're going?
Oh, yeah, I'm going.
Yeah,
Are you kidding?
Yeah.
Yeah. Invited Dan. Dan can't make it. He said, go, Tone, and I'm going. Yeah, he wanted the two of us to come out, so I'm going to go. It's a dream. It's the Augusta of the West.
Yeah.
Yeah, absolutely.
Have you done any other courses? Have you gone Scotland?
I haven't done Scotland. No. I have a buddy there right now. He's at St. Andrews, and he said, why aren't you here? And I said, I happen to be in Mackinac. But I'm going to do that. I went to Ireland, actually. I want to do the Ireland trip.
Well, we're staying over at Mission Point, so we've got an 18-hole putt-putt.
Oh, I'll be there.
That's about my speed.
I'll be there, yeah.
And they even had glow-in-the-dark putt last
night. I have
a
great handicap on putt-putt courses.
That's great. All right, so let's talk about, if beyond what you've talked about, Cypress Point, in the United States, what other courses have you played or would still be on your bucket list?
Everybody wants to play Augusta, which I hadn't done, but I did have a couple opportunities, but I had to turn them down.
Yeah.
Everybody wants to do that. And then I've done the things like Doral and the Carolinas and those. But there's some special places.
You keep the golf balls or the?
Yeah, you have to keep the golf balls. Yeah. Of course, that's
great.
It's a blast.
And your life. Talk about stress. I guess it's probably all settled now, right? Next year, things really shift in downtown Detroit because it's not just fireworks. We're going to have an auto show shift into June.
And Rod Alberts and I have talked at length a lot.
And
that is going to end on the 20th, that Saturday.
Okay.
And they'll clear out Hart Plaza because we load 40,000 people in there, first come, first serve for the Ford fireworks. And so we've talked about ending dates and when to start. And it's so great to collaborate with everybody and to make sure that everybody is flexible and everybody's working together to be successful for Detroit, not just for themselves.
Yeah. I have to tell you one final story as we wrap it up. So we're watching the parade this past year, and I'm home, which is a little unusual for Thanksgiving.
Which is really odd.
And I now have a granddaughter, and I have grandchildren. My wife sees you pop up, and she looks at this. She's not looking at Jim Nance.
For radio.
No. She didn't say that at all. She's not talking about anybody else. There's no star. There's no Jim Nance. she looks and she said, Papo knows that man.
Oh.
You. So I am proud to say I
Really?
know that man, Tony Michaels.
Well, I know you. I
Yeah,
mean, we've
no.
been friends for so long.
Yeah, it's
Thank
great to
you.
see you.
Thank you so
Yeah.
much. This was great fun.
Take
Thank
good
you.
care of yourself.
Thank you.
Thanks for listening to a Healthier Michigan podcast brought to you by Blue Cross Blue Shield of Michigan. If you like our show and you want to know more, check it out at ahealthiermichigan.org/podcast or leave us a review or rating on iTunes or Stitcher. To get new episodes, even old episodes on your smartphone or tablet, be sure to subscribe to us on Apple Podcasts, Spotify, or your favorite podcast app.